Awesome.
It gets me every time.
No, me too.
We're being recorded. All right. Big brother is watching us. And so is everybody else. All right, guys, this is Coach Bronson. And today we have Dr. Rimka, the amazing doctor that I've been referred to by so many people that you need to be on this. I don't even know what, I don't really call this a podcast. I don't even know what I classify this as. This is just interviews that I post on YouTube, like whatever that ends up being. So Dr. Rimka, can you tell us a little bit about what you're a doctor of?
Okay.
First, let's start with that.
Awesome. Let's start with the big one. It always comes up. I am not a physician. So if you think I'm not a real doctor, you can stop listening now. I'll just let people know that right now, because that's like a thing, Bronson.
Yeah.
Not a physician, but there are many doctors out there that are not physicians. Those are not the only class. That's a type of doctor, right? So my doctorate is in chiropractic, but I started in the mental health field. I was working with patients with schizophrenia, and I decided to go the holistic route. I didn't like the drug story I saw, so I was inspired by my chiropractor, and I became a chiropractor.
Yep.
And 25 some years ago. And then my nephew was diagnosed with autism while I was in graduate school, which led me down a path to get further certifications and training in various forms of biofeedback and neurofeedback. So I'm board certified in neurofeedback as well. So I specialize in mental health issues around brain and using brain-based therapies to help reverse the structure and function of brains. And that's really what chiropractic doing anyway. It's a big misnotion that we deal with bones and muscles, because we only deal with that because it houses the nervous system.
Right.
So that's what my degree is, and I've been doing holistic, non-drug approach to health and vitality for 25 years.
I feel like we could have a whole conversation on what you just said about chiropractic not being about bones.
Of course.
Like that concept, like what is she talking about? Can you, just because I think it's information and I just want to get information out there. Can you explain to people what you mean by that? What is that all about? Because I personally, I love chiropractic. I think it's fantastic. I think more people should probably do it.
Yeah. All we're interested is improving your neurology. So the only reason we touch your head or your spine is because it directly houses your central nervous system. So you could look at up here holding the brain and the spinal cord that goes all the way down. Really, the spinal cord is an extension of brain tissue. In fact, your eyes are an extension of direct brain tissue. That's why neurologists always keep looking in the eyes to track dementia and Alzheimer's. That's how they can basically see what's happening without an MRI. So yeah, that's what we're doing. So I have to know things about the eyes, the ears, and your mouth, because it all is affecting brain function. And again, the only reason, I mean, look at where our bony structure is. There's a tremendous amount of bone and protection around that incredibly delicate tissue. And it doesn't take much, and a life can be altered if that's the severe would be, we'd see trauma and paralysis. But inflammation around where the blood and nerve networks are coming out of the spinal cord can have tremendous impact to what's happening at the end point, whether that's a joint or an organ, and how this joint and the organs are perceiving information and telling it back to the brain. So that's the master control system. And that's the only reason we're touching. And it's why there's over 4,000 registered different chiropractic techniques. It's why when you go to a chiropractor in California versus Florida versus Michigan versus Montana, it might look tremendously different. Some will be using their hands, some will be using devices, some will be doing clicking little things, some will make popcorn sounds, and some will make no sounds on you. Doesn't matter what we're doing, just like personal training. There's many ways to use resistance training that might look really different, but you're trying to affect muscle, right? Have a muscle response. You might even hook people up to electrical stim devices and other things to still get this effect, right?
Yeah, absolutely.
We're doing the same thing. So we're basically trainers of the nervous system.
That's awesome. I think that's a great way to look at it. And I think that's probably new news for many, many people. Because I know for me, yeah,
and that's our okay.
I think for many people,
we brainwashed you to think we're pain back doctors.
Yeah, pain back, and it's all about alignment and adjustment of the bones, but not for the, like, why is alignment and adjustment for the bone? Like, why is it important that you have a straight spine? Why is it important that you have these things without things being out of alignment? Yeah, that's awesome. Okay.
It's the free flow of electric information, basically.
Right.
It's the free, and then those nerve impulses, as we would say, that is your life force.
Right. Your data center managers for the body.
It's beyond that, even though I'm going to be really clear. It is your life force.
Right.
We do not say someone is dead when their heart stops, because they aren't close to dead yet.
It's the brain, right?
Yeah. It's when electricity, when we can stop making electricity, we make electricity. When we can't do that, we're done.
Yeah. Gotcha.
Yeah.
Yeah. And so then I'm just, because of my IT background, I'm equating that to a data center manager. And
Absolutely.
the data center managers are responsible for the hardware that supports what's happening on the inside, not necessarily inside.
It's a great way to explain it. It is, because you do have, junk in and process, it's like, is the data coming, is the code good or not?
Right.
Then what's the quality of what's the, the processing unit, right? Yep. And then is the data, that the output going to be good? You can have a lot of ways that's getting messed up.
Absolutely.
Right? So yeah.
Okay, cool.
It's a good analogy. It is a wet biocomputer.
Yeah, there you go. So you went from being chiropractic and doing that to now you're focused more on, explain a little bit more about how your focus has changed. Is it more just lifestyle? Is it hormone management? Is it like, what kinds of stuff are you using now to affect brain function?
Well, I went into school knowing what I was doing. I went in to help people with mental illness. That never changed.
Yep.
I just got piggybacked more I wanted to help schizophrenics and drug addicts. I just got kind of pulled over to autism a whole lot.
Yeah.
It really is all quite similar. So it really has never changed. I've always gone after that to devour whatever would help. And as you go down that rabbit hole of trying to help someone with schizophrenia or in depression and things like that, and then autism, you learn, ooh, the gut is super important. Okay. And then you're like, this gut brain situation, neurotransmitters. Okay. And then you just, and then I was already trained in psychological techniques and understanding the psyche, and I just got further training along that. So it just all kind of adds up on top of each other. I mean, obviously nutrition is a part of that, because I need to make sure I have a sound structure before I can change its function, right? Structure dictates function, and function dictates structure. People don't want to look at it both ways. So you have to know which way are we trying to approach it. So it just, as you do it, you get better and better and better, and you have a case you can't figure out, and then that makes you better, because then you've got this doctor, take this course, contact them, hire a mentor, and you help them, or even refer them and say, I don't know what to do. Can you help teach? And then that doctor, that's how I've learned the majority. Then they teach you on that. And then sure enough, another one comes and you're like, oh, I've seen it before. And you just get better and better and better. So anybody who's doing this, that, is always been holistic and functional like me. I've never taken insurance in my life. I've always been a cash practice. So I've always had to produce results. Nobody's kicking me patients, never.
Right.
So, you better keep going. You better keep knowing what you're doing. So it's all just driven deeper into brain performance. And actually, like, instead of adjusting here, I want to go straight to the brain. So I just started going straight to the brain, looking at physical obstructions, chemical obstructions, psychological and emotional and spiritual obstructions. So,
okay, so you just rattled off 4 things. Hold on. Physical, chemical, what was the other 2? Spiritual.
Yep. Psychological, emotional. They're all, you have to address all of them.
Okay.
So I trained and I study all of them. Okay.
So can you give us some examples, like, so you take each of those and maybe give us some examples of things that are, I would maybe self-generated and or external environment generated things that could affect your brain health
brain function
for those categories. Yeah, brain function in any of those categories.
Yeah. So, okay, let's go physical. 2, I'm going to go with a very obvious structural issue.
Okay.
Well, okay, very obvious to me. And I'm going to be specific, and I'm going to say an obscure one, because this is a big one that I learned about in practice maybe 5 years ago, and it was kind of stunning to me.
Yeah.
The mouth, the palate. So the roof of your mouth, the shape of the roof of your mouth is determined by the width of your jaw. And if anybody who studied any Weston A. Price the dentist who traveled around and has looked at this, how our jaws have become narrower and narrower, and now teeth are getting bunched up, and people need braces now, which we never used to, because that's happened directly related to changes in diet, increasing carbohydrates and sugar. So the jaw doesn't have to chew as much. And in one generation, it's proven one mom will change that baby's jaw in utero. Well, when that narrows, not only are the teeth getting crowded, and we have issues based upon that, we have major issues where the palate, the roof of the mouth, instead of being like this, it suddenly has to spike up, and it starts jamming its way up into the brain. It changes, and your pituitary gland sits there. The brain, that's the roof, right? That's the roof of, I mean, that's the floor, right? Roof of your mouth, but it's the floor of your brain.
Right.
And it's where, so there are tremendous impacts on brain function, sensory integration issues. I now know, I always look in the mouths of children, and often I have to deal with, we have to change the jaw structure to change their anxiety, because it's being driven by
crazy. That's crazy.
So that's a not obvious structural issue where I don't care how much therapy you try to do on that kid. Ultimately, that's causing the entire the nasal passages as well as the throat structure to be completely obstructed. So if they're supposed to have 9 millimeters and they only have 3 millimeters of air, they're constantly being choked to death as far as their brain is concerned. So they're always going to be panicked. You can't talk therapy a child out of that.
Wow.
You need to fix it. Okay.
Wow.
Another,
that's the
more,
first one. You're blowing my mind already. Okay.
A more obvious would be concussion.
Right.
Okay. A big bruise to the brain. We can have tremendous, mood changes, cognitive and mood changes, even slight concussions, especially with children getting repeated concussions in like a football season. Okay. You can turn a happy kid into an anxious, depressed kid for years after that because of that.
Yeah. I'm just, as far as that goes, I'm glad that so much over the past several years has come out about that, about concussions. I see so many things being done wrong in youth sports programs. I think of all of the things for them to get right, this is definitely one of the things that I'm glad to see. The level of caution and the level of, wait a second, we need to relearn, think about how we handle concussions is changing. It's not quite there yet, I don't think, but it's changing.
It's definitely not there yet by any means. No, I mean, they're trying.
At least they're trying, right? I guess is what I'm saying, right? Yeah.
And if you want to follow a great physician, I work with him in practice, is Harry Karasitis. He's a physician. He's a neurologist. He's one of the few that actually understand it. He refers patients to me. He actually has no ego, and he understands neurofeedback, and he is on a mission to try and change the concussion trauma story, especially through sports.
Awesome.
Because it's outrageous. It's the biggest is high school boys, and then followed by high school soccer. I mean, I had so many concussions playing soccer. It's insane. And you just keep going. I mean, they never pull you. I mean, it's, you never get pulled, and you don't want to.
I don't know what you're talking about.
You just lie about all of it so you can continue to play. You know what I mean? You're a child. You have no idea. So.
Okay. So that's too physical.
That's a physical, but I'll tell you, physical as well would be malnutrition.
Okay.
Right. So a brain that's starving of the structural substrates of what it needs. So I will say, like, we'll go to examples, a long-term vegan and an anorexic. Their brains are going to be structurally deficient in cholesterol and saturated fats and things of that nature. And they simply are not going to be in a position where they can repair and heal as well. And function.
So let's talk about that real quick. And can you dig into what the brain needs?
Yeah, there's about 10, 12 main pillars, but let's start with the basic. You're an animal and you're animal fat. You're basically red meat and fat, animal fat. That's what we are. Okay. So the brain is about roughly 70 to 80%, depending on which research and how you extrapolate, cholesterol and saturated fat. Animal, right? Saturated fat and cholesterol. You need a tremendous amount of it. You need, so that's huge. You need DHA, omega-3s, DHA, APA, these essential omega-3s we cannot make enough of. So you need to be getting these things in your diet.
Oh, you just said something that I want, I think it's important people to be reminded of. What is the difference between an essential nutrient and a non-essential nutrient?
Oh, great. That's the thing in the video I said wrong that I told you before we started.
Oh,
I literally went, I was so tired, I made a big mistake. So essential means we have to eat it. We cannot manufacture it ourselves.
yep.
So something that's non-essential, we can make if we have enough of the pieces, right? We can't make it out of nothing. People
Mhm.
sometimes, whoa, I make it. Well, if you don't eat the essential things, you probably can't make the non-essential things either.
That's,
'Cause
that's
they're
actually
different.
an interesting point that I never even thought about, is connecting the two. Like,
Yeah.
there's things that we could make, but we need some of the things that we can't in order to do the things that we
Right.
can.
Like creatine.
Yeah, I
Right.
don't think I've ever made that connection before.
Right. It's like people like you say, well, creatine's not essential. Why should you supplement with it? I'm like, well, but to make one of the three amino acids is essential, and another one is semi-essential depending on your age. So, like, if you aren't getting enough methionine because you don't eat enough meat, you are not making enough creatine because you don't have enough methionine, and the body has to prioritize what it's going to do with all the
Right.
methionine used everywhere and all methylation. So, you got to be aware of that. And so if you're not
That's
getting
an,
enough, you can't do those things either. But certain things we cannot make and you have to get them. So we
okay.
have proteins. Certain proteins are essential. We must eat them because we cannot make them. And certain fats are essential. We have to eat them. There are 0 essential carbohydrates on planet Earth for a human
Oh
being.
my
So
gosh,
we
you're
don't need
crazy.
ever,
What are you
we
talking
don't ever
about?
need to eat them because nothing's essential. It might help make things easier for us to get what we need, but you don't have to. Okay. So,
Right.
so that's what that is. So there's certain things. So there's lots that the brain needs, that omega-3, DHA, EPA, critical. Choline is a big one. You
Mhm.
can get all the choline you need from eggs and liver. All of these things for the brain are super abundant in animal foods, by the way.
Right.
B vitamins. Whoa, man. B6, B12, 9. I mean, we just need a lot of B vitamins up there, and you
Mhm.
need a lot of salts up there, magnesium and
How much salt do you recommend?
well,
So
I'm not
I'll say
into
sodium, not salt, but
prescribing.
sodium. Yeah.
Well, I don't ever recommend just sodium, but lots of people should read the salt fix.
Mhm.
Um, and but sodium, potassium, magnesium are like your big kind of salts we're going to be using a lot. So a lot. You
Yeah.
should, we used to salt our food. We used to
Probably
salt
more
our
than people are getting now, right?
Probably. There should be no restriction on salt. And I don't, but I'll make a caveat. That is not that table salt crap that people have been sold as salt. That's not salt.
Yeah.
So, and what manufactured processed food is calling, that stuff is not actual real salt. So that's a different that's not what I'm talking about.
Right.
I'm talking about sea salt, Celtic salt, mountain lake salt, salts that we would use and preserve our food with.
Yeah.
You know,
Stuff that would normally have been bled into our water system back in the day before we had filtered and fluoride and all the other stuff that we do to our water to make it
well,
horrible.
we used a lot more salt. We ate a lot of blood. We drank a lot of blood. That was very
Mhm.
normal, and it's still humans. Lots of cultures do. Lots of salts are in there, but we were using salt a very, very long time ago to preserve meat. So we
Right.
learned that trick a
Right.
very, very long time ago. We didn't just depend on the water. We figured out for the way we did things that we could get a lot of it that way. Salt, that's ions. People, electrolyte, salt, ions, the same thing. It's what creates the electricity in your brain.
Mhm.
So when I talk about, that's all, we're creating electricity and sparks all over the place. A human body, just as an aside, I mean, we have the potential, each cell of what's there. This is roughly I believe it's 2 trillion. Maybe I'll speak wrong. It might be 2 billion volts of energy.
Oh, wow. Okay.
It's an insane amount of potential energy that we really
It's like,
are.
it's like in the Matrix, right? That's what it's all about.
Absolutely.
Just
We are,
batteries.
we are batteries. We are electromagnetic batteries. Yeah. So
Okay.
there's physical, right?
Okay. Yep.
Okay.
Let's go to the next one. The next one was chemical.
Chemical. So we could look at damage, heavy metal
Okay.
poisoning, lead, mercury, copper, cadmium, arsenic getting into the brain. I mean, mercury poisoning. There's a reason why if you broke a thermometer in a school, hazmat teams were called in.
Right.
Okay.
Right.
Very, very, very dangerous. And why there's that caution around eating seafood at times. If you're pregnant, oh my God, don't let them have any seafood, but please inject them with 1,000 times the amount in a needle. I don't understand
Yeah.
it.
So, okay. So is the seafood thing really a thing?
It is a thing. It is.
Okay.
I don't,
Because I know people that eat seafood every day and have for like a long time.
I would test them to
Yeah.
check. I would be running metal tests on them to be checking.
Okay. Yeah.
I'd looking for mercury and some of the things. And there's different forms, and we know that, and we test for it. We go, oh, well, that form is not a big deal, and that one, it leaves the body quickly. I would check them to be sure,
Go check
you
yourself.
know, because they may have incredibly effective detoxification systems and they're fine. Somebody else might do the same thing, and their glutathione levels or methylation in their liver cannot process that, and it's starting to accumulate in places like their brain.
You're touching on a bunch of different things that I haven't heard people talk about in a long time, but I believe I want to say it was Chris Masterjohn, who maybe last year, a couple of years ago, he had something, he put it on social media that was basically, and it said it like over and over and over again. He was posting a blog article or something, and it said, your liver is not a filter. It's like, your liver is not a filter. Your liver is not like explaining the process of
Well,
the
people want to think
liver and
it's dirty, like it's a sponge. It is,
right.
it does filtration.
Mhm.
It does so much more than that, but it's
Yeah.
like packaging and coordinating everything. All of your cholesterol, you can thank your liver. I mean, creatine, you can thank your liver. I mean, it's insane what the liver is doing.
Mhm.
Honestly, I think it's the most underrated organ. I just think because it's ugly, we don't give it the love, it's supposed to get. It's not as sexy as a heart or a brain, right?
But it does so much, right?
So it's, I could see where you're saying that, because people will think, oh, you should never eat liver because, see, it's the filter, it's the sponge, it's so full of the poison.
Yeah.
It doesn't
But
retain any poison or toxin in it.
and that's the point I think that he's trying to make. That it's more like transmuting things from bad to inert or bad to not
Yeah,
as bad,
it
and
just
then
moves it.
flushing it
Yeah, it
than it
cleans
is. It's not like a screen that things are going through and just
right,
collecting
right.
crap.
It's the filtration. It's like saying you should never eat a kidney because the kidneys are dirty because they filter. No, that's not true. They filter it and take the stuff into the bladder, but that
Right.
doesn't mean they're full of this stuff. That's not how it works. That's not, so yes, he's correct.
Okay, so heavy metal toxicity is one, and I've heard people talk about that before. Is that's definitely being something that I hear more from the functional medicine side of the house than I probably do hear anywhere else.
Yeah, it's super common. Copper toxicity is a huge problem as well, especially with women. Copper and estrogen are tightly related. And if you've been on the birth control pill or had multiple pregnancies, your anxiety and depression and potential psychosis could just straight up be a copper problem. Simple as that. And that's
Wow.
caused by
Does
birth
that
control
include
pills.
does that include IUDs?
Yeah.
Okay.
I
Interesting.
I think that's one of the worst health abominations in women's healthcare ever, all the birth control stuff. And I get socially and politically like how that empowers us and all the, you know what I mean? I
Yeah.
get,
Yeah.
the body sovereignty. I'm a woman, I get it. But you look at the consequences of, well, what's the cost though? We have to
Right.
remember there's always a cost, and manipulating hormones this way is very, very dangerous just in and of itself. But estrogen and copper go together. It's a very, very critical, we need copper, and for a baby to develop, you have to have it. And I think a vast majority of miscarriages are because copper is not, there's not enough copper for that woman. And so
Yeah.
the miscarriage needs to happen for the baby's sake. But anyway, that's another, it's super,
Okay.
super, super common and not understood enough. And I think
So we just
they're mentally ill, and they're not.
yeah, we just got into another thing that we're talking about women issues now, but what about breast implants? Because I've heard some things recently about the is it mold, or there's something that happens with the
There's so much
implant
that
itself
there's so much
that
that
can
happens.
poison the
Oh
woman,
yeah,
things like that.
I've had many patients have to take them out.
Really?
Oh yeah. Yep.
So that's a known thing.
I mean, it's not a known thing. I mean, why would plastic surgeons want you to know that? I mean, there are people driving Ferraris because that's all they do is put those
Right,
things
right,
in. I mean,
right.
so you can get Groupons for it now. I mean, it's Oh yeah. I don't know why anybody would think that's a good idea, but I've seen it. Like, wow, I'm not sure
Wow.
I want braces from a Groupon, but a breast job? Ooh, I don't know about that. If that's a good choice, mama.
Wow. Okay.
Yeah, I mean, and I think you're going to see a dramatic increase of women having responses and asking for them to go just based on a frequency resonance where the body is going to, as people are, I think we're transcending, just if we're going to get woo woo, but I do think we're transcending in consciousness
Yeah.
across the planet. And as people come more in alignment with who they are and take sovereignty over their body's going to reject a foreign object even more. It's going to say, I don't know what the hell these things are, but get them out. So the
Yeah.
body has no choice but to constantly be attacking that.
Yeah.
I mean,
Absolutely.
it's a foreign object. I don't care if it's silicone, water-based, I don't care what it is. It's going to say, get this out of here. And it's going to make adhesions, and whether it's mold, fungus, or bacteria that are going to be encapsulating themselves around, of course that's going to happen.
Yeah.
You know, we have normal bacteria flora in our breasts that I was never taught in school. No physicians are taught this in school. I learned it about 5 years ago at a function. We're like, what? Some obscure researchers were discovering all this normal, basically probiotics that are in our breast that are stopping and helping us, stopping breast cancer and things like that from developing. But if we, by using antiperspirants and all other kinds of nonsense and we're ruining, and all the antibacterial soaps and triclosan, we're killing the things inside our ducts there that are keeping it alkaline pH. It's not that the acidity causes cancer. Cancer causes acidity. You kill those, cancer takes over, now it's acidic. So
Right.
there's so many things that we are not taught about our bodies. And the fact that, you know, I get how that's an amazing procedure for people if they've gone through severe trauma, mutilation.
Mhm.
And you know, I mean, hey, if I lose my arm, I want a fake one. Get one on me. You know what I mean? Like,
Yeah.
I think there's amazing things that have been done with plastics, and you know, and
Sure.
I think we've also gone excessive with it and without any thought,
Well,
rhyme, or reason. Like that's a good
that's
idea.
that's our society's nature. Excessivity
Yeah,
is kind of, yeah,
yeah,
what we
but
do.
it's a real thing. And some women, that's ultimately the thing that's caused all their mysterious illnesses that nobody can get them better from.
Interesting. Okay, cool. This is such great information. Thank
I
you.
know. So we were on chemical. That was one. I said
That
heavy.
was one. Well, we want to count that as two because
Okay.
we talked
Okay.
about metal and
Sure.
we talked about implants.
Sure.
Okay.
Sure.
Spiritual was one.
Yeah, that's a good one.
Since you just started getting a little woo-woo, let's keep
Yeah.
going down the woo-woo.
Well, there's a couple ways to look at, well, I'll probably cover maybe the psychological and spiritual at the same time with two different things. So one way that'll be easy for people to accept are the idea of unconscious scripts, right? So we have conscious thought, things we're aware of, which is
Mhm.
running about 10% of the show. But the things you do and in your life, your behaviors are really driven by the 90% you can't see, like an iceberg, right? So we
Mhm.
know what we see above that ocean is this tiny thing, and there's this huge thing underneath. So by the time we are 2 years old, all of our scripts have been given to us by our family dynamic. You have belief systems that were given to you by your parents and everybody around of what men are like, what women are like, what I am like, what the world is like. So whether you think, you know, men are safe and comfort me and I am strong, or be afraid of him and the world is horrible and I'm weak, that's all kind of put in there. And our job as we grow is to kind of dive into the depths of the ocean and bring things to light. That's raising your consciousness. That's becoming aware of the things that you are not aware of. It's like, I don't even know what I don't know. And
Right.
as you start to know what you don't know, you become at choice if you're going to let that autopilot recording that you don't even
Mhm.
know is playing, let it run you any longer.
Right.
Right. So that's a big part of what I'm doing, is looking at unconscious scripting, helping people dive down into their unconscious and deep hypnagogic states with neurofeedback and deep states training and things,
Mhm.
and get rid of those things. And so we have unconscious things from our parents. We also have traumas that have happened in other ways that we've just pushed down there. We can also look at the idea, if we want to get with a spiritual thing, that these are some transgenerational traumas that are passed along inside the DNA, as well as past life, multi-dimensional lives, right? So my job is to look at all of that. And I also look at what's in the field. Like, what's actually, we are much bigger, this electromagnetic being, we can measure it. So those spiritual concepts of teach people to go within and stop looking without, go into access their third eye, pineal gland, and create deep awareness and go into the inner space and not be so concerned with this and allow their own divinity and answers to come out within. Well, you can't do that if your brain is so disordered and so chaotic, you never know how to be still. You can't do that if you're so terrified to go into the depths of the ocean to look, because you think all you're going to find there is that I'm a piece of shit. They don't realize within all the shit are all the diamonds. Right? So so it takes courage to go down into the coal mine and dig through all the black darkness to find the diamond, right?
Okay.
You can get a lot of courage when you start having brain stability. That brings emotional stability. That brings up courage to do things that are hard. They're not so hard anymore, right? So it's all kind of connected. Did I make that make sense?
No, I think so. Yeah.
Out there? Okay.
Yeah. I think that we may have talked about this a little bit when we kind of talked a couple of days ago, where it's I'll just use the example that you had mentioned then is, sometimes a depressed person isn't, they're not lazy. They're not doing something because they don't want to, right? They probably do very much want to. There's just that whole process of keeping them kind of in that space of, I don't know how, I don't think I can, whatever it may be. And you got to deal with some other things first before you deal with, how come you're not doing this?
Yeah, I'll say that's a great example. So what we talked about for people listening is that one of the best descriptions, what typically I hear a lot, I've heard it hundreds of times, is like the analogy of that person that is suffering from typically, it's a brain function disorder is depression. Depression is the brain's attempt to save itself. Okay, we have to remember that. It doesn't do anything. It's not because it's stupid. It is trying to stop you from the behaviors, thoughts, or environment that is exposing you to something that it needs to withdraw from and go inside, get quiet and go inside so it can heal. Now, we've ostracized that and stigmatized that so much that people think it's a bad thing that they want to stop engaging so much, right?
Yeah.
Now, that could be straight up caused by a brain inflammation issue that it's very hard to pull yourself out of. So it's often, they describe it as if like a blanket of concrete has been poured upon them, right? So like when you get up in the morning and that comforter should only seem like a couple pounds, it's 100 pounds. And it just makes it's not that I don't want to get up or I don't know how to get up. It's like, so that just to get up was a tremendous amount of energy and effort. Gotcha. My job is to come along. And then when you go through this day after day, hope fades. Right. And if hope is gone with a patient, we're done. So my first job with that type of client is to be a strong stand for hope. And I have to be very honest with them. I get it, like, you don't believe any of this is going to work, right? Like you really, usually it's a spouse or a parent bringing them in. And like, it takes a lot of work to create a little bit of buy-in. And if I can get that little hook where they think, and I get just enough to like, I know, like, maybe I can help. Like you're thinking, maybe she can do this, right?
Yeah.
And they're like, if I just get that, I said, here's the thing. Like, great. I don't need you to believe this can work. I don't. I know you don't think you can do this at all, like out in such a way. And they'll always cry, like, yeah, I'm like, and I get real intense. I'll get real intense at times and be like, but I want you to, like, I gotta prove to them I'm strong. I'm like, can I get you to believe I can do this? Right. And they're like, yeah. I said, okay, I will hold all the hope for you. And I will never work harder than you, but I will come down to this pit and I will give you my hand and I will never break. I will never stop pulling. And when you finally can climb and pull yourself out, I'm gonna keep, and there comes a point and they all understand that. And then it comes a point, I step away, I go, you see it now? And they're like, I see it now. Now they still have a ton of work to do on their own. Right. But it's that fine balance of, I am not saving you. I'm not rescuing you, but I will hold hope for you and intend it for you because I am strong enough to do that now. Yeah. I get you're hopeless. And a lot of people will throw away people when that person becomes hopeless because they don't know how to tolerate it themselves because it makes them uncomfortable. Like
Right.
they're lost. And I'm like, I'm not
Well,
afraid of that, you
because
know?
they also don't know how. They don't have a
Yeah,
plan. They don't have
yeah,
a
they
plan to
don't.
help, to
Yeah,
either help, or the person that's going through it doesn't have a plan. So even if they did have hope, what do I do?
yeah.
So, and that's where you come in with both, right? You've got the
And you
plan.
don't need a
Here's what
plan.
we
I
can
mean,
do.
just a lesson for anybody holding intention for someone is that's a level of mastery for you to be able to
Mhm.
hold vision of the outcome you want it to be. So if you right now are struggling, if you're listening to this and someone in your life that you love is severely depressed and struggling and you don't know what to do, your number one job is to focus on having your vision of them. You see them only as well. You see them in the future and you see them well and happy and vibrant. And you never go down. You do not, when as soon as it happens, you self-correct. If you go into, I don't, are they going to kill themselves? Are they going to hurt themselves? Are they going to become a drug addict? Are they going to start drinking again? Whatever's going on, you redirect and you hold vision for them. You can even visualize and meditate on it every day, very actively. Your job is to see that, and then your language around them will change. You will say positive things. You will start to create in that field of, well, that's, you're well, you're strong. But if you start seeing them as sick and you pathologize them and you'll go down that road with them, you're going to just keep creating, you've got to discipline yourself on that.
Yeah, because you don't want to establish, you don't want to unintentionally establish an environment where that's the expectation. You want to create the expectation to go the other way. Yeah.
Yeah.
This is fantastic. I have a question now that we're talking about depression. And we hadn't planned on us specifically talking
Sure.
about depression,
Sure.
but you combining some things that we've talked about so far, gut brain connection,
Yeah.
brain depression connection,
Mhm.
right? So what is that connection, or where does things, where does, how does what you eat work through that path? I guess that's a really broad state. That's a broad question, but I don't know
Yeah,
if you kind of get where I'm going. Like, how does
sure.
nutrition affect depression
Sure.
through the
So,
gut, or however?
well, we'll go real general. Like I
Right.
said, if you don't have those basic foundation of what the structure and the nutrients that the brain needs,
Mhm.
everybody is highly susceptible to low performance in their brain. And one of those things is going to be potentially depression. It might look like attention deficit. It might look like anxiety. It might look, um, you know, whatever. So getting enough nutrition is critical. Enough saturated, I mean, start with enough calories, okay? Real basic. We're not in a starvation famine situation.
Right.
We have enough saturated fat, cholesterol, enough choline, enough of the B vitamins, your omega-3s, these nice basics that we kind of need. And so let's say we have that dialed in.
Mhm.
Then I'm always going to look at, depression. There's at least 5 subtypes, and one of them is inflammation. Not all of them, right? So there's different. So I have to kind of look at the whole picture. I have to say, okay, but the reality is animal-based foods are going to cover those nutrients, the saturated fat, cholesterol, B vitamins, choline, omegas. They're going to cover my methylation needs, the things I need for methylation, which is a
Mhm.
common cause of brain depression. Is methylation. That's going to handle that. It's very anti-inflammatory. It handles the blood sugar regulation issues.
Yep.
So I start there. Now, it also does help with gut imbalances. Now, you got to look at that a little bit more specifically with what's different strains of bacteria, different pathogens are infamous for
Mhm.
causing mental health issues, for causing panic, for
Yeah.
causing depression, for causing psychosis. So the gut, the bugs in and of themselves create different toxins and communications that go right to the brain that can cause that. So you have
Are
that
there
to deal
are there things that you can do, things that people do that make that worse? So
with. Oh,
I'm thinking like we talked about chemical stuff before. I'm thinking about artificial sweeteners, diet drinks, just processed food in general. Uh,
yeah. Well,
like, does
the
that
big
affect
ones,
that kind of a thing?
yeah, the big one would be the big things, glyphosate.
Mm.
So the poison that was started with Monsanto's Roundup, and now it's in everything.
Yeah.
Um, that the potent bactericide, fungicide that's used to stop weeds,
Mhm.
kill life in the soil. If it was designed to kill life in the soil, it is killing life in your gut because the same things are living there. Okay.
Right.
So
Right.
we are supposed to be in, you know, that flora, those bugs that we were supposed to have gotten from our mother in a vaginal birth, not in a hospital, not in a sterile environment, right? That is the first thing that informs everything. That's how we're supposed to be kind of set up for life. Well, if it's a C-section, totally different flora. If it's in a
Yeah.
hospital, totally different flora, right? If you're drinking, so for me, it's more that so, and plant-based diets are much higher in glyphosate than animal-based diets. So let's just, right? So you have to like, look, so how much glyphosate is gone in there? How much are we killing?
Mhm.
Chlorine if you're drinking tap water with chlorine, you're killing it constantly. How many antibiotics has that person had? How
Right.
much are you eating foods laden with antibiotics, right? Are you eating estrogenic things that are having that type of react? You know, so there's a lot of things that go into this. So I care more about that. So artificial
Mhm.
sweeteners aren't as much of an impact on that whole thing. Food variety, like people, the average American is eating 10 to 12 foods in an entire year. That's not variety.
Right.
That's not getting enough information. I look at raw foods versus processed cooked foods, right? Raw dairy is not the same as pasteurized cooked
Mhm.
dairy, not even
Mhm.
remotely. So things like that. But so I do testing, and I look for big dysbiosis. Is it mold? Is it E. coli? Is it whatever? So, and we address those with different protocols to create harmony again. I do use killers, but in general, you got to realize you're not really trying to kill. We're trying to create harmony. We're trying to let the bugs, because they really know what to do, because they are digesting for us. They are doing a
Right.
lot of the work for us. We're using their genetic code. We're using them to make vitamins. We're using them to do all kinds of stuff. They're doing our immune system. They're making neurotransmitters. They're doing so much. And if you don't have enough of them playing well together, you're screwed.
Right.
So you have to address that just from that standpoint. Then you have the whole, are there damage? Is the enteric lining being damaged in a leaky gut situation where we have constant cytokine inflammatory messaging and proteins and things going into the blood, causing constant immune reactions, which causes more blood-brain barrier inflammation. It just keeps begetting itself. So
Yeah.
they
Can
are
you
one and the same. You have to address them at the same time.
can you go into that just a little bit and explain leaky gut? Because I think that's also a term that is thrown around all the time, but a
Yeah.
lot of people don't quite get what that's all about.
So I'm not sure I totally buy like these food proteins are always going into the bloodstream per se, but you know, with the propensity towards blood food testing and allergy testing and people showing up with 50 food allergies, which is total nonsense. So so the evidence. So some people will say,
Allergic to everything.
yeah, and so you're having a reaction. That's because the whole gut lining is jacked up. What I'm more concerned about is really the bugs that are getting into places and the inflammatory response that's constantly happening. So basically, you know, we're an open hose tube from here, from the mouth to the butt, right?
Yep.
So it's actually open to the
That's a
environment.
visual I'm not sure I needed, but
I
okay.
know.
An open
Picture a
hose from
garden hose. It's a garden hose, though. This
yeah,
is actually, so my intestines are open to the environment.
right.
People don't like, kind of like my skin is. It's a
Yeah,
little bit different. Now, what we have to deeply protect us is how acidic the stomach acid is. That's supposed to kill, you know, almost everything. But again, with the way people are stressed out, not sleeping well, and eating too many plants, their stomach acid gets too high, meaning it's too alkaline, and they're not really killing stuff. And so they get too many things getting into their system. And so then the bugs are like, oh God, you're not supposed to be here. And then the thugs take over and it becomes a big problem. So you have these bugs that are all supposed to be in harmony, even the bad guys, right? Candidas.
right.
People, oh, it's supposed to be there. Candida keeps other people in check. E. coli is supposed to be there. They just, you know, they have their way they do. The gangs all hang out, and some are
Right.
like, you know, the preacher's kids, and some are choir boys, you know, whatever, and some are little thug, but they're all supposed to be there in the right
Gotcha.
ratio.
Okay.
So they get out of communication and don't do their job. And so the lining of the intestinal tract starts having a breakdown. There's a mucosa layer, actually, and it's supposed to be a very sterile little layer. No, nothing should get in there. That starts to break down and rips apart. And then the cells there now rip apart. And then you have a free flow of all kinds of stuff into the bloodstream right there that was supposed to have a nice thick layer of mucosa and tight cells. We call it leaky because these tight junctions get ripped apart.
So things are basically leaking
These
through
things are
your
leaking
intestines.
through,
Yeah.
and the immune system now has the white blood cells, things are activated, and it's constantly trying to fix it, and it cannot fix it fast enough, faster than the bugs that are now that are in a spot they never should have been, and they're going
Right.
haywire because that mucosa was supposed to be stopping it from ever happening.
Okay.
So you have a lot
Fantastic.
of autoimmune people, those things that people call autoimmune. I don't think there's any such thing as autoimmune. I think it's a travesty. Anybody's used that word. It creates victimization and powerlessness in people, but that's kind of the basis of most of it, right? It's a confusion. It's too much. Something that's happened that never should have happened. Just like an injection of things into your bloodstream never should have happened. It's not normal. So the body doesn't know what else to do. It's like, why do we have a monkey virus
Right.
in our bloodstream right now? Like, why do
So,
you know what I mean? The monkey
yeah,
virus should have come in through the nose, the mouth, or something, you know, it should have made more sense to the body.
right,
And then it would have systems. And now it's like, what the hell is this thing doing? Because
right.
it's supposed to, those bugs that are in our gut go out and tell the body, word up, we got a big problem. And the whole immune system says, oh shit, something's down there. And it starts changing its whole
Yeah.
gears to get ready before it gets in the blood. But that's not what you have happen if it gets injected into you.
Right. So autoimmune being I've never thought about it as in terms of it creating victimization.
But
Because
what better way to
but when
tell
you think
somebody
but
they're
when you
deranged and broken?
right, just say, oh well, you have an
You're so
autoimmune issue.
deranged. Your body is so stupid. There is nothing further than telling you you are so far from divine. You clearly need an external God and a priest or a pastor or somebody, because you are so ignorant in this that you can't tell yourself from your not self. Something that human body's been doing for 2 million years. Are you
Yeah.
kidding me? And so that just means, so then it leads to people being angry at their bodies.
Right. And that's kind of where I was going,
Blaming
right? Where
themselves. Yeah.
the idea of I have an autoimmune issue
Yeah.
it becomes something that they're stuck with,
Yeah.
as opposed to, well, you've this issue has been created in your body by the things that you've done, the way you
No,
were
I'm
brought
going
up.
to go
Well,
further.
well,
No,
go ahead. Go ahead.
I'm going to stop you right there, because
Yeah, yeah.
that's still blaming them.
Okay.
So like
Okay.
that, that's what it's designed to do. See, that's how much we've been brainwashed.
Yeah, yeah.
So it's the ultimate hope remover.
Okay.
Autoimmune. And people, holistic doctors use it all the time. And I'm controversial for saying I think that's bullshit. And so I even hate
Okay.
using the term, but I
Yeah, yeah.
know how to say it. I'm like, you have that diagnosis that fall under that umbrella.
Right. Right.
And they do have similar behaviors and emotional trauma, the number one trauma. People who get diagnosed with one of these, shame is always involved. The most potent
Interesting.
immune system destroyer on earth is shame, the feeling of shame.
Okay.
So I have to, there are lots of layers to this, but you tell somebody they have that all hope is gone, because one, you're going to have it for life, but two, it's deeper than your behaviors did this. Your very essence, your very being, your immune system, your body is so confused. It will, obviously, if it's that stupid, it's never going to get you better. And that inherently means you'll never trust yourself. You never trust that you can heal. You never believe you heal you, because wow, my body is so stupid, it just keeps attacking my thyroid. My body just keeps attacking the joints.
Okay.
Because they're not telling you, maybe it's not that these immune cells just going after the thyroid because they don't know what a thyroid is. What if they're going after the thyroid because embedded within it is a bunch of lead, and they're trying to get rid of it? Deep within it is a bunch of Epstein-Barr. Deep within it is some monkey virus that was injected into you. They know that's not there, and they're trying to get to it. Now, in all that, whenever they're cleaning up anything, there's all kinds of other debris. That's why we have a splinter and it's pus and infected. We're like, whoa, look at that. I'm like, well, that's what's got to happen to push that thing out, right?
Right.
It's a little bit of pain and foul smell along with it. Okay. So that's a very different story. Like, what do you mean? It's like, no, Your body is always acting within your highest and best interest. It always know what it's doing. It's always divinely orchestrated. It is genius. That is a very different message to tell somebody than, God, it's so damn dumb. It can't even tell, you from anything else. Like, wow, we're screwed. I mean, what are we going to do?
That's a very
You
interesting.
must need my new pill. You must need pills and injections and surgeries. I mean, what else are you going to do? Because your body's so stupid.
So
But
then
I'm
how do you,
I'm the smart doctor and the smart pharma rep. I
yeah.
have an answer. You see
So
what I'm
how
saying?
do you approach that from I have a way to help you make your body work better? Or what's that conversation? How does that conversation look?
Well, first step is the mind. First step is I have to deprogram from the bullshit.
Okay.
I have to get them to understand that. I have to get them to understand that they are the human body and human DNA is the greatest technology ever created.
Mhm.
And as soon as I can help understand that and how you really are a community of organisms working together in harmony, how there's trillions of actual life forms. I'm not just, I mean, I'm trillions of bugs, viruses and parasites working in harmony to keep me.
Yeah.
I'm supposed to have parasites in me. I'm supposed to, there's parasites in your eyes that keep them clean. If you kill them, you're going to get eye infections. But people don't know that because it sounds disgusting. Ew, it's so gross, right? We're so grossed out by anything, right? You know what I mean? As where you can go to other countries and they're going to feed you cow dung and that's going to make you better because it has spores of bugs in it that are going to heal you from the infection you have. But Americans are so obsessed with cleanliness
Oh yeah,
that
it's
we've cleaned
crazy.
ourselves to virtual death,
Yeah.
right? So I start with the mind. You have to start with deprogramming, and if I can get them to believe and let go that they are strong, that they can get better, and that they are not a victim. If they want to hold on to that victimhood, if they want to keep owning the diagnosis, I can't help you.
Right.
I don't know how to move beyond that.
Okay.
And I'll use techniques. I mean, we'll use Psych K and EFT and all kinds of other techniques to help in neurofeedback, deep states. I have to rewrite that. But
Mhm.
you need a glimmer of hope. Like, I want to believe you
Right.
for real. You know what I mean? You mean this can actually get better? Yeah, I've done it before. They're like, really? Really? They told you what? Oh, pumpkin. That's a
Yeah.
lot.
All right.
Well,
I feel like, man, we could talk all day. Let me ask you about brain health from the standpoint of exercise, lean
yeah.
mass, and things like that. So, we talked about this a little bit before as well when we were talking. I'm the fitness guy. I like to, as much as possible, try to relate things not just to general health information, stuff like that, but also like what is the impact of fitness and why people should be considering or adding some type of thing in. Now, we talked a little bit about maybe not everybody's ready for fitness, right? There may be some people that there's a healing process that sometimes people have to go through first before they think about fitness. But in general, when we do talk about health and general well-being, muscle plays a role, right? It's part of your endocrine system that most people, I don't think, realize. So we can talk about that just a little bit and how that affects well-being. Like having muscle makes a difference.
Yeah, the size of the muscle, how much muscle and the health of your muscle directly correlates to the size and health of your brain tissue. It is regulating hormones. It is regulating blood sugar in there. There's a reason, diabetes, Alzheimer's has been called diabetes of the brain for 15 years by people like me, because the researchers have been calling it for like 20 years. Now it's becoming mainstream. Everyone's saying it. So the first place where all of the blood sugar, insulin response and kind of coordination is happening is the fat cells and the muscle tissue. So those two things have this way of working things out and figuring out how they're going to handle it.
Yeah.
And the muscle is burning through so much of this and regulating as a gatekeeper. So the more you have of that and the healthier it is, the more it's going to protect your brain. So you definitely want, I love Gabrielle Lyon's term of calling it the organ of longevity. Muscle is the organ of, I say it all the time, like that is the best way to think of it, because all the studies will show as muscle mass goes down with age and then bone density goes down with it, that's aging. The decline that can happen with that, it doesn't mean it has to happen. You look at a 75-year-old fit guy, I'm going to say it like this: you never ever see anybody with Alzheimer's who looks you know, they look like Arnold Schwarzenegger.
Right. They're in shape. They're in shape and active. Yeah.
Yeah, they're all, they don't, none of them look like that, because it's like virtually impossible for you to get it if you're muscular and lean and have healthy blood sugar. Okay. It doesn't happen because of these protective
It's this horrible thing that we've been, you know, that's been pushed upon us as society. We have no idea how to fix it. Right. I mean, we talk about messages and the way people think
Yeah,
about
I
stuff and
mean,
everything
yeah,
else. It's
to me, it's
it's
been a concerted effort because the drugs they're pushing directly cause it. And so you have a real problem if you try, you know, you want to get dementia, you want dementia, strip away your cholesterol.
right. Statins, right?
And
Yeah,
yeah,
yeah.
yeah, strip away, go low fat, take statins, have a cholesterol of 175, you know, eat a bunch of sugar, get a bunch of, expose yourself to a bunch of heavy metals and, you know, plastics, chemicals, xenoestrogens, things like that, phthalates and BPA. I mean, you get a recipe for a brain dysfunction. You're going to end up with dementia, Alzheimer's of some sort, right?
Right.
Like, so there's that with fitness and muscle, but just movement, it's long. Like, I like hate using the word exercise with people, because really at the end of the story, we've come up with terms and we make normal life things and we turn it into a prescription because we live so unnaturally. Nobody living connected to nature needs to exercise. They just have movement as a part of their daily life. That's why none of them need to join a gym. None of them need a dumbbell, a resistance band, an X3 bar, a damn anything, right?
Yeah.
They don't need a tonal system, a Peloton, a Peloton, whatever the hell it's called, right? Nobody needs a $5,000 exercise system to stay fit in the tribe, in Africa or the Aborigines, right? Because they're just doing everything connected to nature and knowing that they run and move and walk and jump and climb things, right? They lift heavy things all the time. So they have lots of movement, lots of muscular stress. There's no doubt about it. Physical stress on the body and movement enhances memory and decreases dementia. The studies, they've done meta-analysis on dozens of studies, and it's in that roughly about 38% if you're doing it regularly. So for people watching, that would be regular exercise, right? Looking at a 4 to 5 time a week that you are intentionally bringing extra movement into your life, because most of you are not doing occupations that require a lot of movement. So that's why we have to prescribe a natural thing as an unnatural thing now. And
I feel like that's a whole nother conversation we could have.
Yeah.
Awesome. Well, I don't want to keep you for, go ahead.
Anyway, so we're looking at dementia, prevention. It increases the size, the volume of your brain, as well as the ability. Exercise helps make BDNF, brain-derived neurotropic factor, which in some people, I do genetic testing on some people, exercise gives them 3 times the BDNF as regular people. So like these people, we really are like, oh man, you really want to hit this, because it's like a crazy hit that they get. And usually those people are having attention issues. So if they do not exercise, it's like a dramatic drop in how they perform. And if they do, you get a nice big hit. But that helps you make new nerve cells, and that's extraordinary in the hippocampus for memory. So there's a lot of reasons to do it, and neuroplasticity, which is how the brain can change with training, it helps with that. So and like I said, when people are depressed and inflamed and sick, it's chronic fatigue or Lyme, I can't, please work out. They're not doing that. We start with movement. Can I get them out of the bed to the kitchen? Can I get them from the kitchen to the mailbox? Can I get them to the corner, right? We slowly start with where we are. Some of you, you want to do heavy hit training once a week, which you're going to get massive resistance training results from that, right? You get a big growth hormone hit or whatever, but then you don't do anything the other 6 days. Well, that's ridiculous, right? Because it's movement, right? Then you do need to go walking. You do, I don't consider that really exercise. It's movement. You know what I mean? So absolutely huge brain implications for increasing memory, increasing cognitive performance, staving off dementia, making new nerve cells. The more you move, the more, and it works even if you already have dementia. If you're 60, I mean, this will work. You get them to work out, you get major changes. You get them ketogenic on top of that. Wow. You stack some nootropics on top of that. Forget about it. You give them light therapy. I mean, you can just go, bah, 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 bah. You can't stop it. You can reverse it, but people have to be willing to go there.
Wow. That's amazing. All right. I feel like like I said before, I think we could talk forever, but we'll have to do this again sometime. I know I'm following you on Instagram. I love your stuff. You pull in a lot of stuff from other people as well. Where do people find you on Instagram?
My website is brainandbodysolutions.com or drrimka.com. And that'll take you to learn, basically kind of what I stand for. And you can go from there and find out about my courses. I have an e-learning center that you can get from there. I have a retreat. I do retreats, and it's been the COVID, it is what it is. But my retreat next year, 2022, we had to reschedule it as a safari in South Africa, 10-day. And it's a keto carnivore kind of a thing. And it's more, connect to nature, and I'll do some lecturing, I'll do some talking, and you can Q&A with me till you're, blue in the face. We're going to come up with a bandana system. Like you said, when she has this, you can't approach her. So I have the downtime, I'm not going to read. I guess if you show up with some labs, I might read them. I'm like, okay, what do you got? But I can't fire. I'll read them. What do you got for me? Right. You got a Dutch panel. Want me to read it? So there's that. I do work with people one-on-one, and I run labs and things like that. But I do a lot of group courses with the course button. And so then that'll get you to my Instagram and Facebook, which is Dr. Rimka. But I do a lot of free education, which I hope leads people to, the number one job of us, now that if you're public in any kind of way and you want to say marketing, is really to repel people, right?
Yeah.
So my job is to make sure I only attract who is going to like what I want to hear.
Sure.
And if you don't like it, you can unfollow, and you never have to listen. You can unsubscribe from the newsletter. You know what I mean? But I try in my email newsletter and in YouTube and Instagram, Facebook, like so much educational stuff, because there's so much you can do for free.
Mhm.
And then if you need me to hold your hand a little bit, whether it's in a group course, really affordable, or work one-on-one, we can get you there and get you there faster if you start doing some of the things that I say for free. Yeah.
Fantastic. Awesome. Thank you very much for your time. I super appreciate it. And I'll let you know when this comes out. Let's talk soon. Okay.
Oh, thank you.